Have you ever finished a meal and suddenly felt your heart start fluttering? Your pulse speeds up, your chest feels strange, and your first thought is, am I having an AFib episode? And you're left just sitting there wondering, did I just eat my way into an AFib episode? What if I told you that your stomach and your heart rate are more connected than most people realize? Because AFib after eating is not random. It is not in your head. It is a well-documented, physiologically explained phenomenon with a name, a mechanism, and critically, a set of practical strategies that can reduce how often it happens. Let's get into it. Don't forget to like this video to show your support and subscribe to our Fight AFib channel so you don't miss our next video. First, who is this for? This is for any AFib patient who notices a pattern, episodes that seem to cluster after meals, palpitations that show up an hour after dinner, that uncomfortable awareness of your heart rhythm that seems to get worse when you eat a large meal, drink alcohol, or lie down after eating. You don't need any special equipment for this. You just need to understand what's driving it and then make some targeted changes. Now, let me bust the two myths I hear most often. Myth number one, it's probably just the caffeine. Caffeine is the most commonly blamed dietary trigger for AFib. About 28% of AFib patients really point to it. But here's what the research actually shows. Caffeine has not been proven to trigger AFib in randomized trials, observational studies, or even genetic studies. The 2023 guideline states that caffeine may enhance your awareness of your heart rhythm rather than actually cause an episode, and there's a difference. Your morning coffee is almost certainly not the culprit. Myth number two, there's nothing I can do about it. It's just how my AFib is. And this is the most limiting belief that an AFib patient can have because the mechanisms behind the post-meal AFib are well understood and they are modifiable. Once you know what's driving it, then really you have real leverage over it. Here is what is actually going on inside your body when eating triggers AFib. The primary driver is something called a vagal surge. Your vagus nerve is the main highway your parasympathetic nervous system, the rest and digest side of your autonomic nervous system, uses. When you eat, especially a large meal, your vagus nerve activates to maintain or manage digestion. Blood flow shifts to your gut. Your digestive system kicks into gear. But your vagus nerve doesn't just talk to your stomach. It talks directly to your heart. So when vagal tone spikes after eating, guess what? It releases a chemical called acetylcholine into your atrial tissue. That chemical spreads and shortens the electrical refractory period across different regions of your atria, which are the top chambers of your heart, meaning different parts of your heart's upper chambers are ready to fire at different times. That electrical disorganization is exactly the substrate for a reentrant circuit, which is the mechanism behind AFib. At the same time, the vagus nerve slows your sinus node, your heart's natural pacemaker. And when the sinus node slows down, ectopic foci, little rogue electrical firing sites, particularly from the pulmonary veins, can escape and fire on their own. That combination of a vulnerable substrate and a rogue trigger is how AFib starts. The AHA and the ACC actually have a name for this. They call it vagally mediated AFib, and they specifically identify it as occurring during two conditions: sleep and after meals. But the vagal surge is only part of the story. Your stomach and your left atrium are anatomical neighbors. They are separated by almost nothing. And when you eat a large meal, your stomach expands and it physically compresses the posterior wall of your left atrium and the adjacent pulmonary veins. That mechanical pressure distortion activates stretch-sensitive ion channels in your atrial tissue, directly altering its electrical properties and promoting this firing. This is sometimes called the Röhm-Held syndrome or the gastrocardiac reflex. It's a real documented pathway from your dinner plate to your heart rhythm. And now add to this the hemodynamic shifts that happen after eating. Your cardiac output increases by 20 to 30% after a large meal as blood rushes to your gut. And you have increased pressure on your left atrium from the inside as well as from the outside. And if you have acid reflux or GERD on top of all this, the esophagus sits directly against the posterior left atrium. Acid exposure activates this vagal nerve fibers that further amplify this cardiac vagal response. A genetic study actually found that GERD independently causes 34% increased risk of AFib, not a coincidence. And a pilot study found that treating GERD with a proton pump reduced AFib symptoms in 81% of patients who had this response to esophageal acid. This is a gut-heart axis, and it is one of the most underappreciated drivers of AFib that exists. Now that you understand the mechanism, here's a practical 6-step protocol to reduce your postprandial AFib. Follow these in order because each one addresses a different layer of the same problem. Step 1, shrink your meals. The single most direct way to reduce the vagal surge and the mechanical compression of your left atrium is simply to eat smaller portions more frequently. Instead of 3 large meals, aim for 4 to 5 smaller ones. A smaller meal means less gastric distension, a smaller vagal reflex, and less pressure on your posterior wall of your left atrium. This is the foundational step. Everything else builds on that. Step 2. Eliminate alcohol with meals. This is non-negotiable. The iStop AFib randomized trial, one of the most rigorous dietary triggers studies ever done in AFib patients, tested multiple potential triggers. Alcohol was the only one that reached statistical significance, more than a 2-fold increase odds of an AFib episode. Alcohol acutely shortens the pulmonary vein refractory periods. It promotes vaguely mediated episodes and worsens GERD simultaneously. If you drink wine with dinner and you have postprandial AFib, that is your most likely trigger. Remove it first. Step 3, treat your GERD aggressively. If you have acid reflux, even if it feels mild, talk to your doctor about an empiric trial proton pump inhibitors. Something like omeprazole 20 to 40 milligrams daily for 8 to 12 weeks is what they'll usually recommend. Monitor your AFib symptom burden during that period. The mechanistic rationale is strong. The intervention risk is very low. And for a specific subgroup of AFib patients, particularly those with paroxysmal AFib and a clear temporal connection between reflux and episodes, the evidence suggests that meaningful benefit. And step 4, don't lie down after eating. Please don't do that. This one is simple but powerful. Lying flat after a meal worsens acid reflux, increases the mechanical compression of your left atrium and stomach, and extends the duration of that vagal activation window. Stay upright for at least 2 to 3 hours after your last meal. And if you do lie down, favor your left side perhaps. It shows that the right lateral position significantly worsens that acid reflux compared to the left. Step 5, moderate your carbs and the loading at dinner. High glycemic carb meals produce the largest insulin response, and that creates a huge parasympathetic rebound that, again, amplifies this vagal activation that's already happening from the meal itself. This doesn't mean eliminating all carbs. It means being strategic about the timing and the portion. A large bowl of pasta at 8 p.m. is going to give me palpitations. Please don't do that. Followed by lying on the couch is like stacking triggers simultaneously. Spread your carbs earlier in the day when possible. Step 6, get evaluated for hiatal hernia. This is the step most AFib patients have never considered. A hiatal hernia, where part of the stomach protrudes up through the diaphragm, can physically compress the left atrium, worsen GERD, and amplify that gastrocardiac reflex that we spoke about. Case reports have documented complete resolution of AFib after hiatal hernia surgery in affected patients. A 2025 systematic review concluded that both hiatal hernia repair and PPI therapy showed real promise in resolving AFib-related arrhythmias. And if you have post-meal AFib and you've never been evaluated for a hiatal hernia, you might want to ask your doctor about it if you have reflux symptoms. Let me handle the 2 objections I hear most. I've tried eating smaller meals and it didn't help. Here's the honest answer. If your GERD is untreated, if you're still drinking alcohol with meals, or if you have undiagnosed hiatal hernia, smaller meals alone won't be enough. The protocol works as a system. Each step removes one layer of the trigger. Removing only one layer while the others remain active is like fixing one leak in a bowl with 3 holes. You need the full approach. My doctor says diet doesn't really affect AFib. This hurts me. The 2023 ACC/AHA AFib guidelines, the AHA scientific statement on lifestyle and risk factor modification, and multiple studies would say otherwise. Vaguely mediated AFib is a recognized clinical entity and it's in the official guidelines. This reflex between the stomach and the heart is documented in many journals. You are not imagining this connection. Bring this information to your next appointment. Here's the picture I want you to hold on to. Imagine sitting down to dinner 3 months from now. Smaller plate, no wine, You finish eating and you stay upright. Your GERD is under control or gone. And you get to the end of the evening without that familiar dread, without checking your pulse every 20 minutes, without wondering if tonight is the night your heart decides to go rogue. That is what understanding and addressing your triggers can do. Not for everyone, not overnight, but for a meaningful subset of AFib patients. The meal to episode connection is real. It is modifiable, and addressing it changes the trajectory of your condition. Here's your challenge. For the next 14 days, implement steps 1 and 2, smaller meals, no alcohol, track your episodes. Come back and tell me in the comments what changed. The data, your own personal data, is more valuable than any population study. And if you want a complete AFib action plan, one that covers diet, triggers, sleep medications, and every evidence-based tool available, go to fightafib.com. There's a free AFib action plan waiting for you right there. It's built specifically for patients who are ready to just stop reacting to their AFib and start taking real targeted control of it, to restore their rhythm, to generally reclaim their life. Go to fightafib.com and let's fight this together.